So I welcome you all in today's webinar. And I'm Dr. Maryam Zulfiqar, OET mentor at MedExam Expert. And today the topic of our webinar is effective letter writing techniques for OET exam. So I hope after attending this webinar, most of the ambiguities in your mind would be clear out for the OET writing module. So let's start our webinar. And I know most of you might be knowing that that writing module is the most challenging one, but we have specifically arranged this webinar for all of you so that a lot of aspirants I know are here who face a lot of difficulties only in the writing module. And they are very well prepared in the rest of the module, which is listening, reading, and speaking. So today, we will discuss some of the important points and important things about the writing module. So now let's start with the introduction of the writing module. And we know that for this module, we will be having time allocation of 45 minutes, and it is third subtest of the OET exam, like the listening and the reading being the first and the second. And then there comes the writing, and you only have to write one letter in the OET exam. So this is the very basic ambiguity in a lot of aspirants' mind, that they used to ask me in the course as well, that how many letters we have to write. So you only have to write one letter, only one letter. It doesn't matter whatever the type of the letter is, but you only have to write one letter in the exam. So the first 5 minutes are for the understanding of the case notes and the writing instructions. You are not even allowed to touch your pencils in that 5 minutes. And after that 5 minutes are over, then you are allowed to write with the pencil. And I advise you to write it with the pencil, even though it is clearly instructed in the instructions as well. So always use the pencil so that you may be having a margin of erasing the things which you think that these are not accurate, these are not right. So after that 5 minutes are over, you have 40 minutes for the letter writing. And I would say to all of you that just focus on your writing task in the first 5 minutes so that you can gather all the information in your mind, that what are the things you are going to be compiled in this letter. So this is the very basic and necessary thing. Just by reading the writing instruction 2 to 3 times, you may get clear idea that what kind of letter it is and what are the information you are going to provide in your letter writing. So you have to start with the address and salutations part, and you must be having your OET answer booklet in front of you, and you have to start with the top left corner, and you have to write address and salutation, and you don't need to worry about it because address and salutations are given in your writing instructions. So this is exactly what we used to call copy paste, and you have to just copy paste the things from the writing instructions to your answer booklet. And then after writing those address and salutations, you have to write date. So it is the accurate pattern of following the date, because there is an other misconception about writing the date. Like a lot of students ask, like exactly where we have to write the date. So first of all, you have to write address and salutations. Then after leaving one blank line, you have to write date. Okay. And then you have to leave another blank line. In that way, your date, which is written, must be prominent. Okay. So this is the accurate way of starting your letter. And then as usual, you have to write some of the patient details, like the patient name and the date of birth. Nothing else is required, because I used to see a number of letters in which students used to write occupation, patient address as well. So let me tell you, these are not required when you are writing the address and salutations part. You only need to write the patient name and the date of birth. And then you have to focus on your case notes. In this way, you are done with the first part of your letter. So if you are going to follow like this in the real exam for the address and salutation part, Your first part is having the total out of total. So the thing is, you must be good in this part. After that, there comes the body of the letter, and this is the most significant part of OET letter writing. So this is the letter, and you must be knowing this thing that you have to make paragraphs in it, because in the end of the writing instruction, you always have an instruction like, please make the note form. Sorry, do not make the note form. It means you don't have to make it in a note, you have to write it in paragraphs, because already these are the case notes, there are no paragraphings. So the thing is, you have to make paragraphs for this. And we know that now we have started the body of the letter, and it should contain purpose. Purpose of the letter is most significant part of OET letter writing. The thing is, some of the students don't know that what is the significance of letter, purpose of the letter, and they used to write just randomly, like Mr. John presented to me with complaints of shortness of breath, dizziness, whatever the complaints is, and they forget to write like there is a purpose which is the most significant, which is the most vital part of the OET letter writing. So your purpose must be written appropriately. And if there is anybody who is from our course, they should know that, like, how we can write a beautiful purpose. If your purpose is written accurate, then you surely score grade B if there is no other grammatical mistakes and format is also correct. So the thing is, if you think that you have not done well in the rest of the letter, but still you are pretty sure that your purpose of the letter is very good, there are chances you can get grade B. So I think by this statement, you all can get an idea that purpose of the letter is this much significant, that if you are not performing very good in the rest of the letter, but your purpose is excellent, still you are standing at level B. After purpose, there should organization of case notes in paragraphs, and approximately 4 or 5 paragraphs are sufficient, and each paragraph must be having 3 to 4 lines. So this is exactly the answer of word count range, because a lot of students also ask about how we can keep our word count in normal range. So this is the answer for this. After purpose, you make sure that you are going to write only 4 to 5 paragraphs for your letter, and your every paragraph must be having like 3 to 4 lines. If you are going to follow this, then definitely your word count is in normal range, which is 180 to 200 words. And at the end of the letter, greeting is must, which is yours sincerely and yours faithfully. And we definitely, if you are our course student, you must be knowing that when you have to write yours sincerely and when you have to write yours faithfully. And if still I'm not saying this, most of aspirants know this thing, that in which scenario you have to write yours sincerely and when do you have to write yours faithfully. So it is another important thing to consider. So the important thing about letter writing is format of letter. Format of letter is a very, very important thing to consider, and it varies from letter to letter, as we know that there are 4 kinds of letter in OET letter writing. For your convenience, I'm going to describe these 4 types, which is referral, and it is further subcategorized into simple referral and urgent referral. And then there is discharge, and there is an other name for the discharge letter, which is update letter. And then there comes transfer letter. So in general, there are 4 kind of letter writing tasks for you in the OET letters. And don't get confused if you are having case notes for update letter, like there is a writing instruction for update letter, it is exactly similar to what is discharge letter. So we can say that update letter is another name of discharge letter. So all four letters show somewhat different format of organization of paragraphs. It is essential to understand the proper format. And word count command should be followed strictly, as you may lose your marks if word count is not within the range given. So this is another important factor. This is the thing I have told you, that if you are going to write 4 or 5 paragraphs, each paragraph must be having 3 to 4 lines, then definitely you are lying in your word count range and you are good to go. So these are some of the challenges the aspirants face while writing the letters for the OET exam. So lack of understanding of letter writing, which is the factor number 1, and a lot of aspirants don't know how to write a letter. What are the contents of a good letter and how to write it into paragraphs. They use the note form as given in the case notes and sometimes copy paste the information given, which results in their failure. So this is the important thing to consider. If you don't know about letter writing and you think that you are just copy pasting all the information given in the case notes, that can lead to your failure as well. There was a student, I think 2 to 3 months back, who contacted me for his query regarding writing part. And his query was, ma'am, I appeared in OET exam and I was well prepared. My listening, reading and speaking was good enough. And I'm pretty sure that I can ace these modules. But for the writing, I'm in doubt, like I can be fail in this exam, in this module. So when I asked about him, like if he's pretty confident that he has done well in this listening and reading, which are the most difficult one, and still he faces doubt in for his writing module. So the answer was, he told me that he was only prepared for the raffle letter, and in the exam he got a discharge letter, and he apply the same format and the organization of paragraphs for as for the raffle letter in the discharge letter, and result was exactly the same as per his expectations. Rest of the 3 modules were passed and he was failed in the writing module. So this is the scenario. I have just quoted this example for all of you to tell you that whatever the things I'm telling you for techniques or the challenges, these are some true case scenarios. So please consider these things while you are appearing in your OET exam. So lack of knowledge to implement, aspirants don't know how to use good words, sentence formation, organization and layout, genre and style, language, grammar and tenses. So these are the factors upon which you are being assessed in your OET letter writing. Most of the times aspirants do what they use some of the fancy English language in their exam, and some of the most difficult words from the Google or the internet, they used to search the words and then they used to put it in the letter writing. So let me tell you, this is OET. It is somewhat different to IELTS exam. The thing they are doing, it is pretty good and it is pretty acceptable in IELTS exam. But in OET, examiners love simple English. They love simple and clear, and like if you are going to use simple and clear words, it makes a very good impression in your OET exam. Your sentence formation should be accurate. Your organization and layout of paragraph should be accurate. There must be some accurate genre and style in your letter. And definitely, if there are a number of grammatical mistakes, then definitely you are at risk. But if there are some minor grammatical mistakes and the rest of the letter is good, especially the purpose of the letter is very good, like you can be having no doubt about having grade B. So unable to do time management. So this is another factor, and time management is another problem while writing a letter. Students face a lot of time on thinking what should be written in the letter, and then time goes off. Because another example I remember here, that there was a student who told me after taking the exam that she was doing all of the rough work on her sheets, and then I'm sorry, I don't know what happened to this. Yeah. So when she look at the watch or the timer or whatever the thing is, there was just 10 to 15 minutes left for the letter writing, and still after writing that rough part, she was having no idea that what to write in the letter, and then definitely the result was same as per her expectation. She got, I think, C plus or C, something like that. So time management is also the very biggest challenge for a lot of aspirants. So, by considering all these challenges and all these difficulties, there are some of the tips for all of you so that you can follow these tips. And I'm sure that by following these tips, you can ace your required score, your required grade, which is, if you are going to book your OET exam, please make sure that you must be having 1 and 1.5 month preparation time, because it is the average time, like a student takes for the preparation of the OET exam. So practice at least 30 letters before your exam. And for those students, some of the students used to say that I passed my OET exam in 2 weeks, I passed my OET exam in just 3 days. I'm not going to say this like they are saying just of the fake things or something like that. Most of the times scenarios varies from person to person. Some of the person are doing job, so they can't get enough time for the preparation of the exam. Some of them are unemployed, so they are pretty good in preparing the exam in the 2 or 3 days or the 7 days at maximum. So please don't compare yourself to any other person. You should know about yourself, that on which level you are standing and what are your circumstances, and by considering those circumstances you have to uh, like plan your own timetable, that how can you prepare your exam. But in general, as the average student can take 1 month for the preparation of this exam, and I think 1 month is the ideal time, to be honest. So practice at least 30 letters before your exam. 30 letters are good to go. If you have practiced 30 letter, then definitely you are going to pass this exam. Write the letter with the timer on. This is the very you may say that beautiful advice to all of you, because this will make you prepare for the time management in the real exam. After writing each letter, get it checked from a credible source. This is another important thing, because a lot of time aspirants do write, but they have no clue that what are the things which is not correct in my letter. So it is advisable that you may get checked it from the credible source, either the mentor, any academy, any online platform. What do you think? Whichever is best for you, you can use that credible source. Get feedback of your letters and rectify your mistakes. This is the most important point, because after getting it checked from the mentor, most of the students doesn't bother like what are their mistakes and how they can improve. Okay, what I'm going to do is, and what I usually do is, in our course student, when we will going for the life assessment and some of the letters are not good and not up to the mark, what I used to advise the student is, please rewrite this letter, because on this letter I can't grade and I can't mark you like on which score you are standing. So those students used to submit an other assignment on the same case notes, and then I used to give them a grade and the score. So the thing is, if I am going to score and grade them on the previous letter, they won't even bother to write an other letter. Okay. So for just knowing the grade and the score, they used to submit an other assignment on the same case note, so that they might be knowing that on which level they are standing. I hope it makes sense to all of you. This is very important thing to consider, and I do this for all of the students so that they can rectify their mistake. And when they submit second assignment, to be very honest, it is very good rather than the previous one, and they used to get grade B in the second assignment. So learn from your mistakes and improve. If you feel that you are struggling regarding OET writing, please do not hesitate to ask for help. It is better to seek help than appearing in OET again. this is another thing to consider. If you think that your OET writing is not good, even not writing, it is for every other module. If you think that you are struggling in any of the module, it is advisable that please do not hesitate to ask for help. It is better because you are investing such a huge amount on this exam, and you are investing such a huge amount on the preparation of this exam as well. So I think it is better to invest a huge amount at one time only. Do not write rough, only focus on your original letter. So whenever you are try to write at home just for your own preparation, it is advisable that you write neat and clean so that you may be able to perform well in the real exam. Okay, and this is about format. Like whenever you will be knowing the format of the letter, it is easy to solve any kind of letter writing task. So whenever the person is having information and understanding of all the four kind of letter, definitely he or she will be in a good hand. He or she will be in a good go to perform letter writing on any kind of case notes. But the thing is, when you are prepared only for one kind of case notes and the letter comes vice versa in the exam, so you may get panicky and like you are just your head is going round and round and you are having no idea that what to do now. So it will impact your rest of the test as well, because we know that speaking is after writing, and whenever there is a module in which you are doing mistakes and you have no idea and you are getting panicky about this module, then definitely your other module is affected. So I think so I am understandable to all of you. So it is advisable, please understand and please learn that what are the four type of letter and how you can write these letter on these four types, because every letter writing task is different. Letter assessment is done upon many aspects like accuracy, coherence, word count, English grammar, neatness, etc. So you have to be very particular about these all. Some of the time students used to ask me, ma'am, my purpose was very good, but still you didn't get me grade B. So I think this is the answer for all of the aspirants who think that if accuracy, coherence, word count, English grammar, neatness, and rest of the other things are not in the letter, so definitely you are at risk. I'm saying that purpose of the letter is the most significant part, but still the thing is you have to be very particular about all of these as well. If there are some of the minor mistakes, you are good to go. But if there are a number of multiple mistakes and a massive mistakes, then definitely you are at risk. You may not pass this exam. Every letter has its own trick to compile the case notes, and it is easy, very easy to pick them out. If you are our course student, then definitely you are very sharp enough to easily compile the case notes. If you may know all the essentials of letter writing, then it must be the most doable part for you, and it can only done with the help of proper guidance and the course. So this was all about today's webinar, and we are starting our live course from 15th of March, and the duration of the course is 1 month, and myself, I will be the writing mentor. We have Dr. Ifat Noreen with us. She will be your listening and reading mentor, and we also have Dr. Javeria with us, who will be your speaking mentor. So you will be having access to the material and to the live sessions for 1 month, like for the 1 month duration of the exam until exam as well. So there will be 16 live practice session for all of the 4 modules, and you will be having course content as well. You will be having practice exercises for all the 4 modules. And definitely for my course, for the writing course, you will be having edge of live letter assessment. And it is a very, very good practice, because with the help of this live letter assessment, students used to learn a lot, because it is not only your assessment, In every course, there are a number of students. So definitely when one student is being evaluated in front of other 20 or 25 persons, then definitely you are going to go through the mistakes of 20 or 25 letters in one session. Definitely it will make a huge impact. Speaking practices with individualized feedback and study room guidance. You will also be having session recordings. So whenever you miss the live session, you can easily ask for the recording of that session. And definitely mock exam for final evaluation, because in the writing module, whenever you are going to purchase a subscription for the writing module, then you will be having 3-letter assessment for like free evaluation of 3 letters. So you can submit your letters for the evaluation as well. Access on website for later revision. You will be having access for the MedExam website and 24/7 technical support and easy to follow schedule. So the thing is, definitely if one of you is going to decide like I'm going to take this course, then I would say that you are in good hand, because for OET, we need only 1 month preparation. And if you are going to join this, even though you are working, you can easily follow your schedule, because it is a very flexible one. If you are not going to attend live sessions, and some of the time students do miss their live letter assessment because some of the times they have duty, they have other work commitments. So the thing is, we will review their letters after whenever the session is over. They can submit their assignment and they can being evaluated after the session. So these are our assessment packages, which is plan A, B, and C. And plan A is if you think that you are not well prepared for the OET exam, then I would say that please go for plan A, which includes 10 letters, 10 reading mocks, 10 listening mocks, 5 speaking mocks, and free recorded lectures of all 4 modules. And then if you think that, okay, I'm not sure whether I'm prepared or not prepared, you are standing on 50%, then the thing is you would go for plan B, 5 letters, 5 reading mocks, 5 listening mocks, 2 speaking mocks, and free recorded lectures of all 4 modules. And then if you are prepared enough and still you have a fear and you think that you may fail this exam and you are having some of the ambiguities in your mind, then for those students who are 75% prepared, I would suggest them plan C, which is 3 letters, 3 reading mocks, 3 listening mocks, and 1 speaking mock. And still after having the results, you think that you need some extra struggle, then you can book by your own. But I think so if the student is prepared for like 75 or 80%, then plan C is for them. So let's ask question, because I know that you might be having a number of questions in your mind. And thank you so much for your presence for today's webinar. So there is a query in the comment box which is saying, can we use pencil in reading and listening part? Yes, you can. And it is always advisable that please solve your test with the help of pencil, because you will be having a margin of erasing whatever the thing is. So in whatever the type of the module is, it is advisable, please use HB pencil for solving your exam. And I think so team has shared the free group activity link. It is a very good healthy activity which is going to be done in free groups, and Dr. Huda is conducting this free group activities. Please everybody make sure that you are a part of this group so that you can evaluate yourself by these free group activities. And is there any other query in the comment box, or you can easily ask, can you ma'am share any writing sample with us? Dr. Ruma, I think. Ruma, I'm not getting you, like what kind of, if you want sample, definitely we can provide you the sample. And if you are talking about for this webinar, So in this webinar, I'm not going to share it, but if you can ask for like subscription, and if you are, even if you are not asking for the subscription, you can ask from our team, from the writing samples. And the charges for plan A, Salman Haider is asking for the charges. So Faizan, please help him regarding charges. And Dr. Fatma is asking which cases come under category of urgent referrals. So this is a very good question, Dr. Fatma. Sorry. So for the referral letters, whenever there is a kind of emergency scenario like the myocardial infarction, stroke, and acute exacerbation of asthma, and whenever the patient is a child, and some of the other scenarios like renal failure and something like that, definitely these all are urgent referral letters. Whenever you are having a chance to write on these letters, you have to consider these letters as urgent referral letters. And Dr. Amanullah is asking how many times OET is conducted per year. Dr. Amanullah, OET is conducted after every 2 weeks. So any other question? Yeah. Ma'am, can anyone elevate us for choosing which one package to subscribe? Ijaz, I'm not getting your point. Like, I told it very clearly that if you are not prepared, plan A is for you. If you think that you are 50% prepared, plan B is for you. And if you think that you are lying on 75 to 80%, then definitely you can go for plan C. But still, there are some of the students who are extra brilliant and they think that they are 100% good to go. But still, for them, I advise them to please take a mock exam for their self-evaluation. And charges of the 3 plans, is the session online or live classes? Faizan, can you please help Dr. Abdullah for the charges? And the sessions are live classes. And whenever you are missing your live session, then definitely you will be having the recording of that session as well. And Kanis Fatma is asking for charges of plan C, please. So backend team, please help the student with the charging plan. And okay, so question will come from medical subjects which we have studied in medical career, or it will come from special books? Kindly elaborate, please. Yes, Dr. Amanullah, questions will be from medical background, both in speaking and writing. And for the reading and listening, it would be always be the same. Like you will be having a monologue, you will be having a dialogue, but the content would be from the medical background. And same for the writing and the speaking as well. Okay, thank you, ma'am. I am up for plan B when we are going to start it. Okay, Dr. Jaz, you can start it anytime. For these plans and the assessment packages, if you are prepared like 50% and you are going to start with the plan B, you can start it today. It's totally up to you whenever you have time. Ma'am, if the letter is about to refer to a professional, what type of letter is this? So Dr. Ruma, your answer is in your question. You are asking about the referral. So definitely it is a referral letter. And yeah, this is important thing to do. Everybody, please share your feedback on this webinar. I think so you must be a part of our free group. If not, please join the group and please share your honest feedback so that we may improve ourselves. It is not for like, if you think that it was not good enough, still you can make some suggestions and we can improve our services for you. And payment for plan B. I think backend team will help you into this. And how many questions will be given per paper? How much we need to correct it per paper to get good score? Please take a look, ma'am. Dr. Manullah, can you please specify which module you are asking for? First time to appear. Okay, so the question was how many question will be given per paper. So Dr. Amanullah, pattern of OET letter is the same. It doesn't impact you whether you are appearing for the first time or the second time. In the listening and the reading, you will be having 42 questions and you have to score 30 out of 42 to get grade B. And for the writing, there will be only one letter writing task. And for the speaking, you will be having 2 role play cards to practice. So this is the pattern of the OET exam. So any other question and any other ambiguity in your mind, you can please ask me. And please don't forget to write your reviews. You can even message the team, or you can even write your comments in the free group. Okay, I think there are no more questions. Okay, there is one query. OET fee structures including tuition fee, exam fee, please. Fee structure, if you are asking about OET fee, so I don't think so. The tuition fee is the other thing which is not included in your exam fee for appearing in the exam, because you have to select your own organization, your own study source for preparation. So definitely you have to invest there as well. So tuition fee is something different with the exam fee. And please share your feedback. Yes, the team is again reminding everyone, so please share your honest feedbacks on today's webinar. Ma'am, do we have to write like this 18-year-old or just simply 18-year-old in letter writing? Okay, this is another good question. Whenever you are going to write patient name and the date of birth, it is advisable, please write date of birth. And whenever you have written with the date of birth in the address and salutation part, there is no need for writing the age again, because this thing will be counted it as repetition. So please don't need to write it. And yes, for one of the time you have written hyphens, and I think without hyphen it is more advisable if you have to write age. But if date of birth is given, then you have to definitely go for the date of birth. How can I join the group? A friend sent me the link. This is first time joining. Yes, if Dr. Abdullah, if you are having the free group link, definitely you can join it with only just single click. When can one book for OET? Dr. Ravish, you have to make account your like the test taker portal on the OET website, and then definitely whatever date suits you. What do you think, like which time span you required for preparing the exam? Because there are multiple dates given till December 2024 on the website, and whatever the date suits you and you think that you will be prepared enough by this time, you have to book that date. So any other question or any other queries? So there is another one. Ma'am, after your sincerely, what should we write? After your sincerely, if you're a doctor, you have to write doctor. If you are a nurse, you have to write registered nurse. Whatever the profession you belong to, you have to write your profession. If we are referring patient in same hospital, do we have to write receiver address fully? Definitely. Still, whatever the thing is written in the instruction part, you have to follow this. Should we mention doctor name? No, doctor name is not required. Even some of the time students do Dr. XYZ, Dr. ABC, Dr. dash dash dash. Please don't do this. You only have to write doctor only. So any other question? I have some issues in address. Dr. Sidra, can you please explain what kind of issues you are facing in address? I sent a request now. Please kindly add me to the group. I think if you have sent a request, you must be added to the group. Or Faizan, you can check if he is added in the group or not. So I'm waiting for other queries. If you have any other queries, please let me know. And is there anything regarding course, regarding mock exam, any of the thing in your mind, you can please ask me. Okay, I think there are no more queries. And now there comes another one, ma'am. Is the OET same for UK and Ireland? Yes, for every other country, for every country out there, OET exam is the same one, and it is being conducted by Australia. So it doesn't matter like from which country you are appearing, exam is the same. Ma'am, should we write most recent visit first or initial visit first, then recent visit of the patient? Your question is very good, but still, I would say for this question, for understanding the answer of this question, you should attend our course, because in general, I can give you the general answer that you have to start with the initial visit, but for every letter, arrangement is different. So I think your ambiguity would be clear out when you will be having proper understanding, and this can only be done with the help of a course. So definitely, it is a very good question. I'm not saying this like your question is not good or appropriate. It is a very good, but the thing is, for every letter, arrangement varies. Can you please explain OET pattern again? Sorry, I missed early talk. Okay, so I was talking about the pattern of the OET exam for reading, listening, writing, and speaking. For the listening and reading, you will be having 42 questions total, and you have to score 30 out of 42 for achieving grade B. And for writing, you will be having only one letter writing task. And for speaking, you will be having two role play card in front of you, and you will be playing the part of a doctor or a nurse, whatever you are. And the examiner or the interlocutor will be playing the part of a patient. If we writing to occupational therapist, what should we write? First body para, do we have to write social background or presenting complaints? It doesn't matter to whom you are writing. It could be the speech language therapist, it could be the occupational therapist, it could be anybody, any doctor, any nurse, any social worker. You can be writing to anybody, but it doesn't matter to whom you are writing, but it matters what kind of letter it is. I hope it may make sense now, because the thing is, we don't have to decide upon recipients decision, like to whom we are writing. We have to decide the organization of paragraphs according to type of letter, like if it is referral letter, if it is urgent referral letter, whatever the type of the letter is. But for journal understanding, you have to write social history always at the end of the letter. All the four modules conducted on the same day? Yes, Dr. Ravish, all the four modules conducted on the same day. How much time is required for prep, and which book should we consult? Dr. Kenza, I told in the webinar that 1 month or 1.5 months is required, and but it's truly varies from person to person, because some of the person are doing job, some of them are not doing jobs. So the thing is, you have to make your own circumstances and then decide. But in general, 1 to 1.5 months is required for preparation of this exam. And for the book, if you are asking for the book, unfortunately, there is no book for the OET exam preparation, but there are multiple sources. And if you are like having confusion in your mind for the book and the study material, I would advise you to join MedExam course. Then definitely you will not be worrying about the material and the content and the books. We will provide you everything. If we're writing for home modification due permanent paraplegia, then Dr. Ashish, still we have to write social history at the end. So I'm happy there were a lot of participants in today's webinar, and this is a very positive sign for all of us. But still, due to this strength, I would advise to all of you, please share your honest feedbacks. You might be knowing that your feedbacks matter a lot for us so that we may improve ourselves, and if we are good, but please let us know that on which level we are standing to help you guys. Please share your feedback. Definitely, my team is also saying the same. So please don't forget to write your review. Sorry, I missed the webinar. Can I get the recording? Yes, Dr. Faria, you will be getting the recording of this webinar by tomorrow, I guess, tomorrow or Monday. From where I can get the recording? I think so. Um, the team will share the recording in our free group for the link of the recording. So that's why I'm saying to all of you, please share your honest feedbacks on our group and please join our group. Asking for the recording. Yes, everybody out there, you will be getting the recording. For this reason, you have to join our free group, and the link of the recording will be shared in the free group by tomorrow or Monday. Any other question? Thank you. It was helpful. Thank you so much, Dr. Abdullah, for your presence. Please let us know the cost of various plan. Yes, Dr. Abdullah, you can get help from the team. Team, can you please help Dr. Abdullah into this? No, ma'am. Thank you so much. You are welcome. Ma'am, any positive history of patient like hypertension or diabetes? Where should we write? Like in which paragraph? Definitely in family history, and it should be always at the end of the letter. Any other question? Okay, thank you so much, all of you, for your presence in today's webinar. And yes, team has reminded you as well for sharing the feedback. We all are waiting for your feedback so that we may organize an other webinar for all of you. Thank you so much for your presence. Good luck. Allah Hafiz.